introduce yourself briefly, name, country, and your role related to lymphedema, for example, patient, therapist, doctor, or advocate?
Hello, my name is Daniela Poposka. I'm a clinical oncologist from Skopje, Macedonia. I like to empower and I like to present your work here and your poster because if I compare to work in my country with this kind of patients and quality of life with patients with lymphedema, speaking and taking in account that most of the patients in low or middle income countries have radical mastectomies, and after that radiotherapy, they are fighting with lymphedema, most of them, more than 50%, but we don't have enough data to say the true numbers, and we still unfortunately don't have organization to make an effort to do another investigation, to collect data and to do something to prevent or to make better life for the patients with lymphedema.
How is lymphedema treatment supported or reimbursed in your country, and which lymphedema patients are eligible for this support? For example, for compression garments, reimbursement available to all patients, or to what extent it's available?
Okay, maybe I cannot remember for all the question, but for example, let's start with the reimbursement. There is no reimbursement for compressive
Garments?
Garments for our patients. They're all buying by themselves out of their pockets. And I usually recommend for all patients after surgery, because we are speaking mostly about radical surgery, radical mastectomy, to put the glove after surgery and to keep it for at least 6 months. And usually if the patient is younger, if it's active and need to do activities around home and at work.
But it's not reimbursed?
It's not reimbursed.
And is the MLD therapy reimbursed in some way?
No, nothing. It's not reimbursed. There's a difficulty in referring the patients to MLD techniques because not all of the specialists in physical care are trained to do the MLT good. There are some specialists that are doing, but mostly they're working private.
In Bulgaria, the National Health Insurance Fund decided to reimburse only 30 euro per year and only for breast cancer-related lymphedema. In your opinion, is this amount sufficient to cover compression garments? And what does such an approach mean for other lymphedema patients who are not breast cancer patients?
I think that 30 euros per year per patient is not enough. It's not sufficient, and we know, and we all know that. Especially we are talking about patients who need to have good quality of life, who need to go to work, who are active at work and at home. So we know that is not enough for the one thing. And for your second question, it's not only the breast cancer patients that are dealing with lymphedema. We know that patients treated for gynae cancers are the other group who is concerned with lymphedema, especially if they also underwent on radiotherapy. So there are the other population also with big numbers who need to be treated as they deserve.
Thank you very much.